Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hi, good morning.
Good morning.
This is a question for Dr. Hrkal, I think. So I recently got a virus, just like norovirus, maybe like 2 weeks ago. Now I have something else, which is why I sound weird, and it's early in Los Angeles. But it what I'm wondering is it sets me back really, really far, right? So, to not be able to be exercising mentally, it really seems to, when I have a virus, it seems to affect my mental health a lot, just like chemically. Something seems extremely, different other than just like, oh, I'm sick. You're sick, you're down, you're, not able to exercise, you're not working, you're not feeling great. But it really seems to set me back pretty far for a matter of weeks. And I'm just wondering if there's, I know my naturopathic doctor had said a long time ago something about like a chronic viral response. Is there something that happens or that I should look for, that check for, just that any kind of sickness wouldn't set me back for weeks or get me completely off my workout routine, or my body is just totally and completely decimated? Like, is there anything that I should be, I guess, looking for so that a simple sickness, it seems, wouldn't be such a huge setback?
Yeah, you know what? We see this type of response quite a bit in people that have chronic issues and whether it's post-concussion issues, whether it's chronic autoimmunity. So it's not just specific to persistent concussion stuff, but usually a virus is an immune stimulus. And that immune stimulus, the stronger the virus, usually that's why COVID has been associated with what's called long COVID syndrome, or persistent post-COVID symptoms. And this is a very virulent virus that is going to impact multi-systems. And ultimately, the virus is sensed by our body's mitochondria. And our mitochondria are very responsive to inflammation. They're responsive to these types of external stimuli. And then they get impacted. And that's why people get brain fog, they get fatigued, they get all these kind of...
Yeah, mentally, I just felt completely different. Yeah.
Exactly. Suppressive symptoms. And that might translate into for you, mental symptoms such as poor cognition, poor mood, even things like depression, because we know depression is an inflammatory issue now. So, ultimately, the big picture answer is we have to figure out what is still limiting you on a cellular level. Do you have chronic neuroinflammation that's happening? Do you have any sort of deficiencies like vitamin D or iron that, again, can be exacerbated when we get hit by a virus? So if a person is very sensitive to virus, it's a key sign to me that their immune system and their mitochondrial system is still very sensitive. And that can re-trigger neuroinflammation.
Okay, so how do you test for that, or look for, or what do you look for? Like, what would I, other than like testing for vitamin D levels or...
Yeah. So I'm assuming you've checked all those basic things off in this conversation, obviously.
I'm having it redone. I had it done at the beginning, but I'm having it all redone. I went through basically and took notes on your module about all the core nutrients and all the everything, and just compared those notes with what she had ordered for my labs, because it's been a long time since they've been that comprehensive. So everything is being ordered based on just, what you had said in those modules.
Okay, good. So there isn't testing that we can look for neuroinflammation that's readily available. There is some autoimmune testing. There is some things being done in the laboratory, but honestly, they're not really available from a clinical perspective. And if they are, they're very expensive. So I don't think that they're necessarily worth the cost. Because I think that the solution, which is ultimately what you're really after, is going to be addressing the systems that are dysfunctional in your body. So is that the autonomic nervous system? Is that the gut brain axis, which I presented on very recently? So we have to look at and kind of critically assess, and this is usually with the help of a functional medicine doctor or a naturopath, to figure out, okay, so where is your area of metabolic susceptibility and weakness, and go after that. And for many cases, in my experience, it is your body's HPA axis. That is your hypothalamus pituitary adrenal axis. And that's basically your stress response. It is going to be producing cortisol and DHEA, and those two hormones help regulate and suppress inflammation. And if they're too low, then we're not able to properly manage that inflammatory response, and it can get too excessive. We know after a concussion, there is a suppression in our body's HPA axis. And then usually in chronic symptoms, after kind of a spike and trying to support the body's healing pathway, where there might be elevated levels, we call it chronic high cortisol, high stress. A lot of people with persistent symptoms decompensate into very low levels or suboptimal levels. And that can be one of the key issues with immune dysfunction that's pretty chronic. So I usually direct my patients into that, and then you can test for that, because that is where you're looking at.
Is that something that so I just finished and sent off my kit for the Dutch.
Yeah, that's going to be tested by the
that's
Dutch. Yes.
going to help with these answers.
That's right. And I'm glad you brought that up, because I thought that you were doing that testing from what you've shared before. And I think that's going to really help give you some key insight. Now, that's not the full piece. There's some preventative nutrient aspects that you could do. I'm really a fan of medicinal mushrooms, things like cordycepsis, Panax ginseng, which is an adaptogen. I'm naming these. We've talked about them in other live seminars before. Go back and look at the nootropics section and the adaptogen section. They are really helpful. A lot of the core benefits of these evidence-based botanicals and mushrooms is immune stimulation and helping people prevent getting into the state that you experience kind of a major immune issue. So that could be helpful. Well, I think you take them during susceptible periods where, you have, people know during the flu season, anywhere from kind of November to April, that's when usually you're susceptible. For me, and most people can really, on reflection, answer this. For me, it's always like around November, December, when the temperature really starts dipping. And then around this time again is pretty common, where things start warming up. Those change of seasons historically has been when the flu season and viruses have been most active.
Yeah, and I like sort of the structure that Dr. Hrkal is giving us right now, right? So there's prevention, and then there's the stress piece, and then there's when our immune system is already low and we need to really do something because we're constantly getting one thing after the next. So the prevention piece is something that's helpful overall. Then the stress piece, I just wanted to highlight, since that's my area anyways, around how exactly can we modify what we're doing day to day when we notice a downturn in our immune system, or we notice we're picking up things more often than we would. So what I notice quite often with my client group is that when individuals are starting to get sick, or maybe they've got the second bug in the season or a third and they're starting to feel low, they're looking for the things that they can take and do just to keep going. And that just gets us into a cycle of more lending to chronicity, because we're not adapting our day-to-day demands to meet where our body is at. So if you keep going at the pace you're going, whatever that looks like for you right now, your body's sending you some kind of message. It's saying, this is too much. And what's very common for everyone, not just individuals with PCS, but for everyone, is just to sort of say, what can I take? What supplement? What vitamin? How can I move forward at the pace I'm going, and just, keep moving at that trajectory? Similar to what we offer members in the Concussion Fix program is an invitation to adjust our lifestyle and how fast we're moving in society, or how many things we're taking on. Now, there's subtleties to that, right? That could be setting boundaries with family, or not doing too much at home, or remembering how many spoons you have for the day, right? We have this metaphor or this analogy around, say you have 12 spoons, but with PCS, it might take you half of that just to get through your morning. So you only have 6 left. And if you blow through all those 6 in the morning, how are you going to pace out the rest of the day? Most people just ignore this kind of thing and just
Oh,
try to
I wasn't
keep
even, I
moving.
was like not functioning at all, for like in bed for days. I hired babysitter upon babysitter upon babysitter. I was like, I can't function. I'm out.
Right. You're so far depleted at that point. So if we're trying to reverse this, we're rewinding a little bit, maybe to a point before you were hiring babysitters and stuck in bed, there may have been an opportunity to say, oof, I'm starting to feel really depleted.
It
How
hit
can I
me very
adjust?
suddenly. Like I was completely fine, and then all of a sudden I was not fine at all. It was just this drastic.
Yeah,
But
that's
I
it's not
possible
was like,
too.
avoidable.
okay,
Yeah.
I'm out.
Yeah, that's possible too. So just to highlight for the rest of the group here, even if it's not relevant for you, is just that sense of recognizing our habits around stress and our tendencies, which is a very, more broad tendency of people to try to just keep going through illness, through any type of setback, whether that's concussion symptoms or sort of sicknesses. So I just wanted to really highlight that. And it sounds like maybe that's not the case for you, and that's totally okay. And it just kind of came out of nowhere. But what your body is telling you is that now you keep getting these sicknesses back to back, which is just your body's way of saying something's got to change. And maybe looking at that from a broad perspective of how to manage stress, how can I reduce demands, as well as including the supplements and suggestions that Dr. Hrkal is sharing.
Okay, and just to recap, Dr. Hrkal, you said that if it's like this, that something is off on a like a mitochondrial level, is what you're saying?
No, what I was saying is that there is most likely some sort of priming of your immune system. I've used that term in the context of microglia, these immune cells in the brain that are kind of turned on by concussion, and then they can be easily turned on by other immune stimuli, other inflammatory stimuli. That could be gluten, that could be another food sensitivity, that could be a virus. So whenever I see that in patients, it tells me, okay, there's still some neuroinflammation here that is being actively turned on, and it's being turned on more than just a typical virus. Because everyone feels tired after they get the flu virus. But it sounds like to me, it's like more than just the typical tired. It's like the key is all my symptoms get flared up. If that's the key kind of takeaway, then that tells us that there's some priming going on. And that just means we still have to be working on that, all the things we talk about in the inflammatory realm.
Okay. And then you said for preventative, what was the cordyceps?
Yeah, I just named a number of adaptogens. You don't have to remember each one. If you, Nikki's already linked the nootropics
Oh, she did. Okay, great.
one,
I'll
so
look
go
at
back
that.
and take a look at that, and you have so much more context and information. I just don't want you to have to write all that down.
Sure. I just was trying to get the name down. Okay, so she linked it. Excellent.
Cordycepsis.
Okay, great. And then just one quick question, which would probably be more for Dr. Marshall, but maybe you guys would know the answer just because, you always hear him answer. So I recently started the neck manual therapy, and I have a lot of neck dysfunction. Um, it's extremely low, limited movement, etc. And since I've started, I really she also said not to do anything that hurts, which is kind of the opposite, I feel like, of what Dr. Marshall always says, like, you know put go to the grocery store if it bothers you, or push your limits a little bit. And so I would been running, and she was suggesting that when I was running, it was not my heart rate that was bothering me, but more just the positional like of my neck. So I've stopped doing those things. I've stopped going to Pilates. I've stopped running. And she's like, don't ignore the pain. Let's work this out until we kind of sort out these problems. But I feel a big back shift in progress because exercise really helps me. So I'm just wondering, and I've seen a huge increase in sensitivity to noise, irritability, going to the grocery store. I'd gotten pretty good at it, and now it's like, oh, I'm in here for 5 minutes and I'm already overwhelmed. Is it normal when you start any kind of neck thing? Can those be related that it would aggravate those symptoms? And also, is that correct advice? Like, don't keep exercising because exercising really helps the mental piece, And so, is that it seems to be kind of opposite from what he's saying, whatever hurts you, do it. And she's saying, whatever hurts you, don't do it, basically.
Yeah, so I mean, I've heard Cam answer this question numerous times, and I give this type of advice to my patients as well. I think that there absolutely could be a neck reason that certain exercises where your neck is not in a position of stability can cause symptoms. Also, the fact that if you're running, let's say you're running outside, things are moving around you, you have to balance your gait a bit more. Where exercise on, let's say, on a recumbent bike, where you're sitting, or on a stationary bike, there's a lot less of that stimulus. Your neck can be a little bit more of a supported position. So if exercise is helpful for you, which we know in general it absolutely is, I think your manual therapist is well-intentioned by saying, hey, don't do something until we can correct your neck or maybe work on it a little bit more. So I think that advice is coming from there. But if you can control for those variables and still move your body in a way that's not aggravating your neck, I think that is still something you could probably continue, especially if you're getting all these other beneficial effects. So is there a way that you can stabilize your neck when you exercise?
Okay.
Okay.
And then is it normal to have those regression and like the irritability and she said I have accommodation. She tested the accommodation. I have accommodation issues. Is it normal when starting to work on the neck that I would have regression and being able to go to the grocery store and
temporary regression is possible. Yeah. When I say temporary, I mean in the short term, like after a visit, you might feel worse for 24 hours. And then generally, if you're having sequential visits, and usually this requires, 2 visits a week or at least once a week, that on a whole, on a month, you're better off than day 1 on day 30. But if you're worse off on day 30, then that does call into question some issues.
Yeah, it's kind of more a little bit of that. I've only been 3.
Just bring that up. Just bring that up, being like, ask them that. Let them manage those things, because they might say, yeah, absolutely. But it is possible to get, you feel worse before you get better. But if you're on the right track, you're supposed to lean into the symptoms you have and push yourself to tolerance. But the net effect overall is that you are progressing over, let's say, a couple weeks to a month.
Okay.
Okay.
All right, great. Thank you.
You're welcome.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.